It's time for Around the Ozarks Sports Scene, sponsored by Fast Break Sports and The Pitch. Here's your host, Scott Puryear.
Welcome into another edition of Around the Ozarks Sports Scene. I am Scott Puryear. As always, big thank you to you for tuning in this week, and a big thank you to our sponsors, Fast Break Sports and The Pitch Pizza and Pub. We'll talk more about them at the end of the program as we do each week. And I always like to bring on our favorite sports doc in the area for an annual checkup on what's going on in the world of injuries and surgeries and youth sports. And we'll get into some pickleball too, because I know that's going to keep these guys in business for about the next 30 years. But my pleasure again to welcome back Dr. Heath Melugin with CoxHealth. He is an orthopedic surgeon. He's one of the foremost experts on sports injuries and youth sports, and we're going to talk about those subjects and more. Heath, thanks for joining me.
Scott, thanks for having me on.
You betcha. Of course, former standout soccer player at Kickapoo High School, All-American at Missouri State, decided that medicine was right for you. Was that the plan all along when you started, maybe even in high school? Did you think you wanted to go into this?
You know, there was a certain point in high school to where I thought, orthopedic surgery and medicine seemed like a good path. But I will tell you, at that stage of the game, it was all soccer for me. So academics was certainly important, but admittedly, it took a backseat to athletics.
And how many years of schooling now is it for you to do what you do?
Yeah, so high school, of course, and then 4 years of undergrad, 4 years of medical school, and then 5 years of a residency in orthopedic surgery. And then it's optional, but I also did a year of fellowship specifically to specialize in sports medicine.
Is it something that, and most kids, it's an accomplishment to get through 4 years of college. Is there a point during all that you kind of go, man, I've been in this for a long time?
Oh, absolutely. I mean, for all of us, once you get through even high school, it feels like you've been in it a long time. There's, for the process to become an orthopedic surgeon, there's just so many hoops to jump through. And it's kind of one of those things, if you just keep getting through those hoops, then you just keep plugging away.
The soccer part of it, you probably see all sports come in, all walks of life. Being a soccer player, you saw a lot of it as a player. Is it kind of an irony now for you that, hey, I did that, I had that happen, and now I'm fixing it?
It definitely is. It's when I see some of these athletes in my clinic, where let's say they were having a great junior season, either playing football or playing basketball or playing soccer, and they have an injury that really sets them back. And to them, what feels like the most important period of their life, I sit in the exam room, and a lot of times they start crying. I can just feel the pain that they're having and they're going through, and what their parents are going through. Because without a doubt, I mean, for an athlete who's competing, they're in high school, it really does feel like the most important phase of their life. And in that moment it is. And it's tough dealing with that. But the good thing is that most of the time these injuries, patients and athletes recover well, and they get back to doing what they love to do.
Well, you specialize in shoulders, hips, knees, and elbows. I'm 61 years old. I imagine all will go out at some point here in the next 10 or 15 years. Graduated number one in your class at KU Medical School. Did post-grad work at the Mayo Clinic, the Stedman Clinic in Vail, Colorado. Have worked with multiple Olympians and professional athletes. Now you work with Drury as part of that agreement with Cox on their athletes as well. Do you want to name drop anybody on the Olympians, or is that a HIPAA violation if you do? Professional athletes.
We when I was at Mayo Clinic, took care of a lot of high-level athletes, specifically the Minnesota Timberwolves. So you can think of some very high-level NBA guys who had injuries during that time that we took care of. When I was at out at the Stedman Clinic, I mean, essentially any of the Olympic snowboarders or downhill skiers you can think of, we took care of during that year, and took care of a lot of athletes that compete on the PGA Tour, in the NHL, Major League Baseball, across the board. It was a neat experience, really taking care of those athletes. And even since we've been back in Springfield, I've gotten to take care of some former professional athletes. And, one thing that we are super excited about is we also get to provide care for the Ozarks Lunkers, which has been kind of fun having them in town.
I bet. Yeah. And that's a whole different set of circumstances. What, guys running into walls and banging knees on walls and things like that too, right?
Yeah, it's an interesting sport without a doubt. And it does set up for these athletes, unfortunately, to be a high risk for injury. So we've taken care of a lot of them, but we're excited to see their season start here this summer.
What are some of the most common injuries you're seeing now among the younger athletes? We talk a lot of youth sports here. Is it the same old, overuse, elbows, shoulders, and I say young, going all the way up through the high school age where these kids have been doing it for quite a while.
Mm-hmm. Yeah, without a doubt. There's a bit of an epidemic still when it comes to ACL injuries in athletes, particularly female athletes. There's been a lot of research on different programs. Redline, for example, in town is doing a lot of good things with athletes. Cox has things and programs to help prevent ACL type injuries, but we just see a lot of them. This time of year, spring, female soccer players, it's one of the highest risk sports for ACL injuries. That's one thing we see a lot. Another thing, during this time with the spring and going into summer, we're seeing a lot of youth baseball injuries, overuse type injuries, whether it just be a little league elbow or a full-blown tear in the UCL. Many people may be familiar with the Tommy John injury and Tommy John surgery. We definitely see a lot of that. The good thing is that youth baseball and Major League Baseball has taken a lot of steps towards trying to lower the pitch count on a lot of these athletes and hopefully prevent injuries. We still see a lot, but I do think it's going down.
One of the things I love to do with you is just kind of rapid fire various questions that I hear from parents, that are in my head as well. And one of them we've touched on in the past, but it bears repeating. Why the female ACL more so than the male?
Yeah, it's a great question. There's been some thought over the years that maybe it has to do with some hormonal differences between males and females. That's potentially the case. In fact, there was some data to suggest that actually female athletes who are on birth control may have a lower risk of ACL injury. The data is still out on that a little bit, but maybe that has some effect. Really what most of it has to do with is females tend to have a little bit wider hips, which creates a little bit of a knock-kneed scenario when they land. So we call this a valgus landing motion. So in the programs that help prevent ACL injury, what we're doing a lot of times, especially with females, is teaching them to land to where their knees don't buckle in, but they keep them straight out. And that has been shown to be very effective at decreasing the risk of ACL injury.
Do you watch, and I'm thinking of the USC star, was it Juju, the basketball girl? But when you see a highlight or you see somebody go down, do you have a pretty good idea what it is just sitting in your recliner at home? Or, can you see something go, oh, that's an ACL?
Well, we can definitely kind of evaluate the injury. We know what a lot of the mechanisms are for these injuries. So yes, without a doubt, we get surprised sometimes, but most of the time we have a pretty good idea what caused somebody to go down. For example, Achilles ruptures. I remember when Kevin Durant went down with his injury a few years ago, and it was clear immediately that was an Achilles. When I was out in Vail at the Stedman Clinic, one of the doctors I trained under, Matt Preventer, he actually does some of the sports analysis for Fox. So it was always interesting working with him after a weekend of football in the NFL, because that is kind of what his job was. And we helped him in that process of trying to decide, what injury do we think somebody had? And how's that going to impact the team?
It's interesting you talk about the females and the knees buckling in, and I getting to know Jackson Cantwell, for example, at Nick's, one of those 6'8", 315 pounds, wears the knee braces now, has never had a knee injury. Your thoughts on those guys that wear those now, college, high school, especially bigger guys? Does that help prevent? And is that something that girls could look at for basketball maybe?
Yeah, so Jackson Cantwell, what an athlete. It's so exciting to have him coming from the Ozarks. So it's a great question. So there's good data to suggest wearing the functional knee braces for football linemen prevents MCL injuries. So, for example, when maybe a running back or a defensive lineman or an offensive lineman, the opposing team, rolls over onto their leg and actually buckles it in, that is how these athletes develop MCL injuries. So those braces, without a doubt, it is clear, the jury's out on that those help prevent MCL injuries. What they don't do, or have not been shown to do, is prevent, for example, an ACL injury. So unfortunately, we don't think that female soccer players or basketball players wearing these braces is going to help prevent them from developing an ACL injury.
Back to the baseball for a second. We've talked in the past about overuse, pitch counts, things like that. Are there certain types of pitches that are more dangerous than others? Or even now, overuse of throwing too many fastballs, can you get to the same point of the damage on the UCL?
We think so. There's been a lot of thought over the years that throwing curveballs too early for some of these young athletes increases their risk. I think it's very possible, but I think what we found is it really has to do with the amount and how hard they're throwing. So one thing I always caution these pitchers, especially in these young athletes, is we've done a great job at managing pitch counts. And to be honest, the coaches are good at it. The parents are good at it. Everyone's really on top of that. The problem sometimes is we take the pitcher and then put them at catcher. So they're throwing back to the mound just as much, maybe not quite as hard. They aren't throwing a breaking ball, anything like that. But without a doubt, the primary concern is how hard are they throwing and for how long. I think the most important thing, though, for these athletes is to know if they start having some pain on the inside of their elbow, they just need to stop, back off, and shut it down, which is hard to do as an athlete.
You're a dad. Your kids now, where are we on the age spectrum now?
So I have a 6-year-old son. So he plays a lot of soccer. And then I have 8 and 9-year-old girls. One of them, they all play soccer. That's kind of a requirement in our family. My 8-year-old daughter, she's very competitive in gymnastics as well. So that's another sport that we see a lot of injuries because they put in so much time competing and practicing each week that we've really got to watch kind of what they're doing and these repetitive movements. That's where, when I talk to parents and talk to athletes, early sports specialization is a problem. We want these young athletes to be playing multiple sports, which allows them to learn new athletic skill, but also just to give certain parts of their body breaks and try something new.
So you knew where I was going with that then, because you're at an age now where your kids are moving into that age where there's more travel ball, there's more opportunities for in one sport to specialize. Obviously what you just said, is very accurate, that you look at coaches now, it seems like we've actually gone away from the coaches who said, I want you year round in this. And you look at some of the area coaches, they're saying, I want my kid playing football, basketball. And these are the high school coaches, they're sharing the athletes. I guess from a mental standpoint, that's a good thing too. And from the freshness of of looking forward to the next sport and not getting burned out?
I think it is. There's without a doubt. I see a lot of athletes who come into my office who, to be honest with you, it's clear the kids burn out, but the parent loves it so much. Which, as a parent, I get it. One of my favorite things in the world is watching my kids play sports. But it is important from a mental reset, but also giving their body a break to try different sports, try different things, and I think it does make them better athletes. I was talking to the Missouri State soccer coach here recently, and they have a lot of players actually from Europe. And one thing he told me is, some of the American guys are a little better at certain aspects of the game because they played other sports such as football or basketball or baseball. And he feels like in certain areas, having some experience in other sports actually helps them.
Is that something that when your kid gets older and plays baseball, for example, in your mind now, what is that age to be able to throw breaking balls or curveballs, or is there a pitch that's more dangerous in your eyes from what you see and experience?
Yeah, we worry about the breaking ball. The data is not clear if that's really a risk factor. And one thing I've definitely learned is there's not a particular age because it really depends on the particular athlete. Some of our athletes are a little more precocious to where they mature at an earlier age and maybe their growth plates close earlier. So it really depends, but really it has to do with the parents, the coaches, and the athlete needs to really be aware of if they start to have pain. For example, when we're talking about baseball on the inside part of their elbow, they just need to back off and communicate that to their coaches and to their parents.
How do pitchers come back, and I use the word air quotes, stronger than ever from UCL injuries, Tommy John surgeries? Is that a myth, or is it actually something that can happen?
Well, we've definitely seen it. I mean, that's really where with Tommy John himself, after that initial injury and surgery, he did end up coming back, and I believe he was even throwing harder. So I don't think it's a myth. The ligament that we use to reconstruct on the inside part of the elbow might be a little bit stronger. There might be an aspect to that period of rest for the athlete, and rehabilitation allowed them to regain their muscle and maybe even improve their mechanics. I will say, though, it's not always the case. So we do have some parents who come in, their son had an injury to the inside of their elbow. Maybe it's a partial thickness tear in their UCL. And some parents are very quick to say, let's just get this done. They might even come back faster and be able to throw faster after they have this surgery. And we do have to every once in a while counsel in that situation to say, no, I think they can rehabilitate this and get back without surgery. Because it's not always the case that athletes come back throwing faster.
Sure. And we've seen they can tear it again, right?
Yeah, that's exactly right.
Yeah. They look funky. Do the new padded football helmets help in your mind?
I think they do. I think there's actually some pretty good data on that. Yeah.
You think that's something concussions. That, should they all be wearing them?
Probably, I think that's something that's probably here in another 5 years. I bet everyone is.
Yeah. If you have a mom come to you and she says, well, my kid's not playing football, it's too dangerous. What's Dr. Melugin say to that?
I would say, that's obviously their decision. Mm-hmm. I think football's a fantastic sport. There's certain positions that we worry about more than others. A running back who's going down the middle, we know when we look at the NFL, they just don't last long, and they are taking a lot of hits. Linebackers, there's no doubt the NFL and leagues below that are making strides to make it a safer sport. And I think it's a great sport. It's quintessential American sport, and I love it. But without a doubt, there's risk to it. but there's risks in soccer, for example. There's probably, in some ways, more risk to musculoskeletal injuries in soccer in some ways. What you've got in football is the brain injuries, which are ones that, if it does happen, it's tough to fix that sometimes.
You knew where I was going with that with soccer next. I could tell you could see the questions coming, but you still play at all? Do you ever get out there and mess around adult leagues or anything? Or where's Dr. Melugin on the still can play scale?
Well, yeah, that's a good question. Maybe as good once as I ever was. That's probably not the truth, but
sounds like a song.
Exactly. I played in a tournament a couple months ago with some Missouri State alumni guys, and we had a lot of fun with that. I don't get out very often. I play on a daily basis with my son, but he's only 6. So if I need a little boost in my confidence, I just beat up on him a little bit.
What is a growth plate, and what can you learn from it? Because that's kind of one of those things. Well, his growth plates haven't started yet, or we project to kind of explain that whole concept.
Yeah, so the growth plate is part of every single bone that all of us are born with. And when you're initially born, your growth plate's very large because in that area, it's actually made up of cartilage, and your body is making all these new bone cells in that area. Over time, that growth plate shrinks, and you have less cartilage in that region until ultimately one day it completely fuses. In general, the growth plates close for females around 14 and in males around 16. Now, there's a range within all of that, but it's very important in the work we do because we have to be very cognizant when operating on a patient with open growth plates because we don't want to damage that area at all and impact their growth. We also have to be very cognizant to know that some of our athletes may injure the growth plate, and it's much different with how we handle that versus somebody whose growth plates are closed. A question I get often is we have an athlete come in, and first of all, are their growth plates closed? So are they going to grow anymore? And then if they're still open, well, how much growth does my son have left, doc? And that's a tough thing to predict just based off the x-rays. But every once in a while we can tell just a little bit.
And do you ever, do you have a disclaimer when you tell them, or do you ever actually give them, well, I think your son can be 6'8"? How do you handle that?
Well, the best thing to look at is just the parents. And, but I would not, based on just an x-ray, be able to tell somebody, oh, your son's going to be 6'5". And I'm not quite sure. I've never actually heard a doctor say that, so I'm not sure how people get that information. Usually, though, by looking at the parents, we can give a decent range.
How do you explain when somebody has parents that are 5'8" and 5'5", and the kid becomes 6'3" or 6'4"? How does that happen?
Maybe the milkman. I don't know.
Milkman, UPS driver.
Exactly.
A lot of suspects in that, right?
Yeah. No, that's always something that's difficult. But without a doubt, usually in that situation, there's an uncle or there's a grandpa that was also tall, and they just happen to get those genetics.
Don't want to get your phone ringing or my phone ringing, but the injuries you see now, especially in the youth age and even through high school, can you attribute a lot of it to travel ball and too much? Do you see that a lot, or what? We do. What's your stance on that?
Oh yeah, without a doubt, there's certain sports that demand more time from athletes, and travel baseball is one of them. When they go and they travel 4 or 5 hours to play in a tournament, they're going to get in a lot of games because they got to make it worth it. And again, we talked about how we've gotten better at managing pitch counts, but that's a tough thing whenever you've got a really good athlete and you want to win the game, as we all do. So we see a lot of that. I talked about gymnastics. Some of these gymnasts are practicing 20 hours a week with repetitive, really unnatural movements of their body. So we see a lot of injuries with that. Soccer's one that's playing year round and causing a lot of issues. In basketball, we see a lot of quote unquote jumper's knee or Osgood Slaughter's type injuries. And a lot of those, if an athlete tries to push through that injury, it becomes a nagging issue. And a lot of times we just have to kind of shut the athlete down and rest it for a prolonged period of time, which again is very difficult to do.
Kind of off the beaten path of hair, but you're a former college soccer standout, All-American at Missouri State. What you see going on in NCAA with transfer portal, NIL, and things like that? What's your general view on the landscape of the sport and the level you played at?
That's a great question, and it's something that interests me a lot. I will tell you something. My opinion has always been the coach can leave whenever they want. So why can't the athlete? And without a doubt, within maybe not as much in soccer, but in a lot of the bigger football, basketball, NCAA sports, there's been a lot of people making a lot of money off these athletes for a lot of years. Mm-hmm. So I've always felt that there's no reason an athlete shouldn't be able to sell their jersey or sell their autographs. I never understood that. So the name, image, likeness aspect, I think is very good. I think what we've got to get control of, though, is the transfer portal. I think it's so tough for these coaches to build a program whenever an athlete can leave the next year and go to a competing school. I'm not sure I know the answer to that, but it is kind of sad whenever you see what's happened to the sport in that aspect.
You come in contact now with your jury job, or helping the jury athletes, and then also just what comes into your clinic. It seems like when I was a jury, a lot of athletes, who spent a lot of time in the training room, eventually found out that they kind of wanted to make that a career. I know Aaron Kinnaman does a fabulous job over there with their athletes and sports medicine, physical therapy. What would you say to them? What would be your best advice to those kids that are considering that field right now?
Well, we love that. And without a doubt, Erin and her team do such a good job over at Drury. I would say our best clinicians, whether that be physicians, athletic trainers, physical therapists who want to work with athletes and were athletes themselves, we see that they have another level of empathy for these athletes because they were right there. Most of them had some sort of injury that impacted their life greatly. So they really feel that with the athlete. But there's also an aspect when working with these high-level athletes, knowing that there's certain injuries that they can push through and play through, and there's others that they just need to either just rest it for a while or they need to have surgery and go through a recovery of getting better. So to all those young athletes who are thinking about it, we'd say bring it on. We love that.
Tell me a thing or two in your field that has you excited about the future, maybe some developments or treatments coming up in the next 5 to 10 years that, might be a breakthrough type thing that you can kind of give us a little preview of.
Yeah, absolutely. One thing that I'll speak to that has probably changed the game a little bit for some of these injuries that we take care of we talked about baseball. So the so-called internal brace when repairing a UCL injury, we've seen that really revolutionize getting these pitchers back or other baseball players back to their sport. Bryce Harper is one that made a great recovery and a very quick recovery after a UCL type injury. Another one is with Achilles repairs. We saw Aaron Rodgers, and most of us were right there watching his recovery from an Achilles repair. And it's a similar thing. We use a internal brace to fix that. And that has been revolutionary within our field. One thing over the next 5 to 10 years that I'm excited about is whenever we have patients who come in with cartilage type injuries, there's definitely some really good research that suggests we're going to have some changes in actually being able to regrow cartilage for some of these patients. who don't have arthritis, but have a pothole type defect in the cartilage, for example, in their knee, to where I hope we're able to really regrow that and change the life of that knee to where they don't develop on into arthritis and needing a knee replacement, but instead can keep the knee they have.
Awesome. Well, we put it off till the very end. The P word, it's your probably one of your more popular customers now. The pickleball injury, the phenomenon is just swept the nation. It's every place has got courts now. You see a large percentage of those people coming in, I would guess, with various pickleball injuries. And what are the most common?
Oh, we really do. Pickleball, first of all, it's a great sport. Taking care of Jury now has a pickleball club there, and first of all, I think there's been a lot of positives to it. So a lot of individuals who maybe were more sedentary or were moving towards a more sedentary lifestyle have instead become more active and gotten out on the pickleball court. So I think there's more positives than negatives to pickleball. But without a doubt, whenever we get older individuals who maybe haven't been as active in a while and they decide, I'm going to go out and try a new thing, the competitive juices start flowing, they push it a little hard, and then all of a sudden they have an injury. So we take care of pickleball injuries literally on a weekly basis. Probably the most common is an Achilles rupture.
Mm-hmm.
Another thing, we see a lot of ACL injuries and meniscus injuries in the knee. So the ACL, anterior cruciate ligament, we've performed a lot of those on some of the pickleball players. And then the other one is probably a rotator cuff tear in the shoulder. So those four are really the main ones that we see.
What can you do to avoid the Achilles in particular? Because the ACL, it's just going to be probably the way you plant, or there's really probably no heading that off, is there? Or what would your advice be to pickleball players? And I'm guessing that there's some kind of a stretching routine or something you would recommend.
Yeah, you can definitely do calf type stretches with the Achilles. But probably the biggest thing is to not all of a sudden just go out and play pickleball and go 100% right out of the gates. You really should warm up to that a little bit. Get in the gym a little bit, make sure you're walking, maybe even jogging a little bit before you progress into those quick side-to-side type movements that is required on the pickleball court. So warm up, and by warm up, I mean a few weeks before. That doesn't mean you can't get out and play a little pickleball in the meantime, but maybe you aren't jumping to try to get to a ball that is a little bit of a stretch. And then over time,
I'm sorry, go ahead.
I was just going to say, over time, as you build strength in your quadriceps and your gluteus muscles in your butt, that's really going to help protect and prevent injuries that we talked about.
I have guys I play with that are ruthless. They see an old, heavier set 60-year-old man across from them that's back on the back line, and they'll dink the ball up into that kitchen area. Should I just find different playing partners, or just not try to act like I'm 30 again? What would your advice be?
My advice would be to just call it out and then just argue with them, because you're a good talker, Scott. I think you can win that battle.
I had a calf strain that I felt like somebody took a knife and stuck it in there, and I said, never again. You guys can hit it up there, and I'm just going to look at it and say, nope, not happening.
Exactly. They're only going to hit probably 40% of those.
Yeah.
So just let them have their points.
It's exactly. Like in golf, the trees are 90% air. Same thing in pickleball. Let's just avoid those shots there. But, Heath, I love having you on to answer any and all questions, and hopefully we can do it at least once or twice a year going forward.
I love doing it, Scott. I thank you for having me on, and it's really awesome to see what you're doing with this podcast.
Thank you. Send our best to Kelsey, the real soccer player in the family, right?
Absolutely.
Right.
Same to you and your family.
All
I see Marcus in the background.
Yeah. He likes to look over my shoulder while I do the podcast, is what he says. But appreciate it, and we'll talk to you later, okay?
Thanks, man.
Thanks, Heath. You bet. Dr. Heath Melugin, orthopedist at CoxHealth. Again, great player at Kickapoo and Missouri State in their Hall of Fame, and an All-American, and love the fact that he'll come on and answer whatever we fire at him, talking youth sports, pickleball injuries, you name it. He's seen it and he knows how to treat it too. So our big thanks to Heath. Again, thank you to our sponsors, Fast Break Sports. They're located in 3109 South Campbell, your home for all things sports cards and collectibles, supplies to collect them. I know there's some really highly anticipated baseball card sets coming out here in the next few days at the end of April. So get out and check those out at Fast Break Sports. They're at all the area card shows that pop up. So you're one place to go for anything you're looking to have graded or find out the value of some older cards you've had. Go see them at Fast Break. And then the Pitch Pizza and Pub, located in the Southern Hills Shopping Center off East Sunshine, right there in the middle of the entirely renovated shopping center. But one of my favorites for lunch or dinner, pizzas, calzones, appetizers. They've got great wings, place to go watch sports and have a frosty cold one at the Pitch. And, of course, meeting areas. Brian Bevel's got some areas large and small. So if you've got a networking event coming up, you need a place to go meet together, or a special graduation party or a function, go see Brian and the folks there at the Pitch Pizza and Pub. That's going to do it for this week's show. We appreciate your listening this week and watching, and we'll see you next week on Around the Ozarks Sports Scene.